is Justin Mitchell, and I'm going to be taking you through a tour of our Sunshine Care Center clinic. This is our waiting room here at Lila Mitchell. We are actually temporarily located here due to damages from Hurricane Ian back in September. So I just want to point out we have our patient rights and responsibilities as well as grievance policy and procedure here in multiple languages for the patient's view. And we're going to walk over to our check-in window. Here at the window we have our sliding fee scale policy, as well as some Narcan information for patients. If they ever need Narcan, they can come in, or pick it up for anyone. They can come in and pick it up here at the window. Let me get that. And here we have Miss Andrea, and she's gonna kind of walk us through the initial check-in process with the patient.
Hi.
Hello.
I'm Andrea. What's the reason for your visit?
I have a visit with Dr. Hopkins today.
Okay. Can I have your ID?
Sure.
Okay, and I'm going to check to just verify your appointment information in HMS. And while you're waiting, can I have you to fill out this form? This is just a monkeypox and COVID screening. Fill it out in its entirety. And while you are waiting, once you finish that, I would like you just to take your time and read over our privacy policy. And while you're reading over this policy, when you're done, you can bring it back to the window and someone will be with you shortly.
Perfect. Thank you, Andrea. And this privacy practices that Andrea handed to me are actually here in multiple languages. We have Spanish, English, and Creole as well. And we're going to walk over to our, we have a grievance form here for the patients. If they ever have any concerns or complaints, they can fill out this form, stick it in an envelope, and put it right here in this box. We check this box regularly, and we will contact the patient and try to resolve the issue or any concerns that the patient may have. And we have Andrea back. She's going to be checking, calling the patient to go back to the exam room.
Hi, at this point, we'll call the patient in by their last name. Come on in, Mrs. Smith. We're going to be going over to room 1. Come on in. Mrs. Smith, again, my name is Andrea. And we're going to be taking care of you today.
So I'm going to, really quick before we get into that, just kind of point out what we have here in the room. We have our biohazard bin, some oxygen tank here, and this is our electric bed, which we can move up and down. It is also equipped with stirrups for pelvic exams. We'll get this right. And we have our ultrascope up here on the wall, as well as vital sign equipment that Miss Andrea will be taking care of. We have a monitor here with educational information looping for the patient to view while they're waiting. And then Andrea's going to tell us what she would do with the patient in here.
So at this point, I would just reintroduce myself to the patient, collect the patient vital sign and a complete medical history. Once that is done, I'll take the information that I've collected from the patient and I will take it to the provider. I also offer the patient, each patient, a mask, and they can wear the mask or they can decline the mask. So I offer the patient a mask so that they can stay safe and we'll be able to stay safe as well.
Thank you, Andrea. So all of our exam rooms here at Lila Mitchell are equipped the same way. They're set up the same way. Here at Lila Mitchell, we have 4 exam rooms, but our central location, we have 9 exam rooms. We're gonna walk over to our lab area. This is the lab reception area. Here you'll see we have our specimen refrigerator and also a freezer down here. Here we have our ID Now COVID and flu PCR testing machine. And this here is our urinalysis that we keep. And now we're going to be walking over to the blood drawing area. Here on the wall we have our CLIA certification we keep updated. We have 2 blood drawing stations here with a privacy screen for the patients. And our location, our central location, we actually have a separate area, and we have 3 separate blood drawing rooms. We have our centrifuges here for our Quest Diagnostic and LabCorp. And that is it for our lab, and we're going to now walk to our medication and vaccine room. So this is our med and vaccine room. It is locked on a keypad door. We'll cover that. You will see here we have 2 refrigerators. One is for our vaccines, and then we have another one down here for our non-vaccines. Both refrigerators are monitored here, and it check the temperature. Just if it's elevated or it decreases, we'll get an alert to come and check the system. We also have our medications up here for our rapid access program we keep here in this locked cabinet. And that is it for our medication and vaccine room. So we'll take a walk down here. We have our HIV tester and counselor who sets up in this room here, and she'll do any testing or counseling here in this room. And now I will be taking you to the exit. This is when the appointment is wrapping up. The staff will walk the patient out to our exit area, which brings us back into the lobby. And this wraps up our tour of the Sunshine Care Center Clinic. Thank you so much for being with us.